Hello everyone. In this video, we will see the differences between bulbar palsy and pseudobulbar palsy. So in both of these cases, what the lesion that we see is in terms of cranial nerves 9, 10, 11 and 12. In bulbar palsy, there is a bilateral LMN lesion of these cranial nerves, whereas in pseudobulbar palsy, there is a bilateral UMN lesion or an upper motor neuron lesion. Since bulbar palsy is an LMN lesion, the clinical features are dysphagia, which is unable to swallow, especially liquids. There will be nasal regurgitation of the foods that we try to take. There will be slurred speech. Speech will have a nasal quality. When we see the tongue is flaccid. Since remember it is an LMN lesion and LMN lesion leads to flaccid muscles, the tongue muscles will become flaccid due to LMN palsy of the hypoglossal nerve. It will be wasted and it will show fasciculations, which is again a feature of the LMN lesion. In reflexes, gag reflex is absent. Whereas in pseudobulbar palsy, there will be dysphagia, there will be emotional lability, there will be dysarthria, slow indistinct speech, and since it is a UMN lesion, the tongue will be spastic and the jaw jerk reflexes will be brisk. It is important to remember that in an LMN lesion, the cranial nerve nuclei are involved. It is due to a lesion in the cranial nerve nuclei. Whereas in an UMN lesion, the corticobulbar tract is involved, which is the tract coming from the cortex up to these cranial nerve nuclei.